Somewhere right now, an algorithm is looking at a patient's data and calculating with 95% accuracy whether they'll be alive in 30 days. It's not science fiction. It's already running in hospitals. And the most unsettling part isn't that it works. It's how little it needs to know to be right. Let's start with the number that should stop you in your tracks. Researchers trained a deep learning system on over 200 hospital records. They fed it everything: vital signs, lab results, even the free text notes doctors scribble during rounds. The result? The AI predicted which patients would die in the hospital with 95% accuracy. Compare that to the traditional method doctors have used for decades, a scoring system that checks 28 different factors. That system gets it right about 85% of the time. The AI didn't just match human judgment, it beat it significantly. But here's where it gets genuinely strange. A separate study used something far simpler than full medical records. Just an ECG. The same heart test you've probably had at a routine checkup. Electrodes on your chest, a few minutes of waiting. Using only that single test, an algorithm predicted a patient's risk of death within 1 month, 1 year, and 5 years, with 87% accuracy. Not from a biopsy, not from a full diagnosis, from the electrical pattern of your heartbeat. The algorithm wasn't told what disease to look for. It wasn't given a diagnosis to confirm. It just found a pattern in the data, a pattern no doctor had named because no doctor could see it. A signature in your heart's rhythm that correlates with how long you have left. Nobody fully understands why that pattern exists. The AI just found it works. This is called a black box model. The AI gives you an answer. It doesn't give you a reason. It can tell a doctor, this patient has an 80% chance of dying within a year. It cannot tell the doctor why. Now sit with that for a second. A machine can look at the electrical signal of your heart and calculate your odds of being alive next year, more accurately than the doctor standing next to you. And neither the doctor nor the machine can fully explain how it knows. That's not a flaw being fixed. That's the current state of the technology right now in real hospitals. So why does this actually matter to you? Here's the case for why this is extraordinary news. Earlier detection means more time. A 95% accurate warning, days or weeks before a crisis, means doctors can intervene before it's too late. Hospitals using these systems report being able to allocate ICU beds, ventilators, and staff attention toward the patients who need it most urgently, instead of guessing. For something like cardiac risk, knowing years in advance instead of months could mean lifestyle changes, earlier treatment, a completely different outcome. Used well, this technology doesn't predict death. It prevents it. But here's the case for why this should make you uneasy. What happens when a number like this exists, and you're not the one who gets to decide who sees it? An insurance algorithm with access to similar data wouldn't be trying to save your life. It would be trying to calculate risk for a different reason entirely. A prediction designed to help a doctor treat you faster is a different object than the exact same prediction used to decide your premium, your eligibility, or your priority in line for care. The technology doesn't change. The intention behind who's holding it does. And right now, the rules about who gets to calculate this number, who gets to see it, and what they're allowed to do with it are still being written. In most places, they don't fully exist yet. This is the strange position we're in. We've built machines capable of seeing patterns in the human body that no human can see. Patterns so subtle, they live inside an ECG signal, invisible to the eye, obvious to the algorithm. We did this to save lives. And in many cases, it already is. But the same capability, the same number, the same prediction could just as easily become a tool for sorting people. deciding who's worth the investment, who gets priority, who gets quietly deprioritized, not through malice, through optimization, same blind, relentless optimization we've talked about before. So what do you do with this? First, understand that this technology is not coming. It's already here, already running in hospitals around the world, already making calculations about real patients today. Second, pay attention to where predictive health data goes after it's created. Who created it for medical use only sometimes isn't who ends up with access to it later. Third, recognize the deeper pattern. This isn't really a story about death prediction. It's a story about a new category of knowledge, patterns machines can see that humans cannot, and the fact that we haven't decided, as a society, who's allowed to hold that kind of knowledge and for what purpose. The algorithm doesn't care if you live or die. It also doesn't care about insurance premiums, hospital budgets, or anything else. It just finds patterns with terrifying precision. What we do with those patterns, that's still entirely up to us. For now. If this made you think differently about the data already being collected about you, subscribe to Mind and Method. See you next time.